decided to donate 2 million doses of the Johnson & Johnson COVID-19 vaccine to the African Union. At the moment, we have an oversupply of vaccines because so many people are not going to vaccination centres to get the jab. But Africa is battling to get enough vaccine doses. Many health workers on our continent are not yet vaccinated. The health journalist Laura Lopez Gonzalez joins us now. Laura, good afternoon to you. On the face of it, this looks pretty generous. We have more than enough vaccines. Other countries on our continent don't have them. It would seem to be the right move by our government.
Definitely, and I think you pointed out correctly that we've had to delay Pfizer deliveries in recent weeks, pushing them to outer delivery dates because we're not going through vaccines fast enough. So I think definitely good news. I think a very clear recognition that we have high rates of mobility within Africa. You know, historical migration is a thing, and that we're all not safe until all of us are safe. And so in that statement that we heard that was released earlier today, we say Strive Masiwa, who is the African Union special envoy for this, saying that these doses will go over the next year to some of the poorest countries in the continent. And we know that those countries have been very reliant on the COVAX initiative and have basically been drip-fed doses throughout this pandemic. Even the African Union initiative that Masiwa heads up was really struggling to get doses as recently as August. So you were seeing these very small deliveries of 100,000 doses. So I think very good news for many countries who have been struggling to get their hands on the kinds of vaccines that we've been able to in South Africa.
It's tempting to say, well, let's give them to the poorest country or the country with the lowest vaccination rate. But actually, we should probably go across the continent and give them to health workers.
Right. I think many countries are still doing that kind of tiered rollout where they're, making sure that their healthcare workers are vaccinated first, and then their elderly population, and moving much like South Africa has done. So I think when you see these deliveries going to the poorest countries, I think you'll see them go to those most at-risk populations first. I think what will be really crucial is that many countries on the continent haven't been able to plan very well for when they'll get doses. We've heard a lot of fanfare about French donations and U.S. bilateral donations. Many of those donations to COVAX haven't been complete in terms of whether or not they've even been delivered, but then going to the fact that even the doses that have been delivered haven't come with syringes or cooler boxes. So COVAX itself is struggling to fill in the blanks or sort of the gaps of those donations because they haven't kind of come with everything that a country really needs to be able to use them.
And then I hate to ask this question, but I must. The efficacy of the Johnson & Johnson vaccine against the Omicron variant. We know Pfizer has a lower efficacy than it did on the other waves. We've seen different research coming through. I suppose for now, unless you might well have seen research I haven't yet, we don't really know where we stand yet.
Right. I think Omicron data is still very, very preliminary. Even some of the great news that we're hearing, what could be reduced severity of disease, because we're not seeing those hospitalizations and deaths climb as steeply as our cases. Very preliminary. I think we're going to know more in the next 3 or 4 weeks, is what scientists have told us. But we are seeing also some worry that a Johnson & Johnson booster might have to come within 2 months even. So whether or not that really holds true on the J&J promise of being sort of a one-dose vaccine that would be really great for rural populations is starting to be a little bit questionable. And I think you've seen some questions certainly coming from countries around the world that haven't really picked up on it so far. What's really important, I think, to know is that right now vaccinations are showing good protection against that severe disease and hospitalization, and that's what we are very clearly seeing from the stats that we're hearing from Gauteng so far. Even KwaZulu-Natal saying most of their inpatients for COVID-19 are unvaccinated. So we still are figuring out what I think exactly Omicron means for vaccines. But I think the point that many scientists are making right now is if you haven't been vaccinated, to do so, because vaccines are still preventing the worst of this.
Laura Lopez Gonzalez, I really appreciate the time. Thank you, the health journalist. Important conversations coming through there, both about Johnson & Johnson and what's happening on our continent.